please, once again, a giant round of applause for Sareh Heidari.
Hello, everyone. It's actually, I'm Sareh Heidari. It's absolutely such a pleasure to be here in Leeds for the 9th edition of All Day Hey. I've actually been wanting to attend since the first one, but it's actually the first time I've been able to make it here, so thanks so much. It's such a fantastic venue, such a fantastic conference. Let's give a round of applause for everyone who's made this happen for us. I'm Sarah. I work as a software engineer at F1 Arcade at the moment. Before that, I was at a health tech startup for a few years that was working with the NHS, and before that, working on BBC websites. And over the past decade, the running theme's mostly been being interested in tech for different types of public service, as I mentioned. And that's been something that I've had an interest in for a while, even before I got into tech. So, on to the topic to today. So I'll be talking about digital inclusion, what it means, what is it, what does it mean, who does it affect, and how can we change it. So before we start, we're in May, sunny Leeds in 2025, but let's go back to a few years ago, back to the summer of 2020. Yeah, sorry, boo, yeah, pantomime boos, yeah, boos. Yes, maybe it's a time we would rather forget, but let's just reflect a bit. Summer 2020, I perhaps, like quite a lot of folks in tech at the time, was working from home. We were out of one lockdown and had a break and into another. Didn't really see many people, so most of my photos were from the flowers and trees outside from my very short walk. And I was quite lucky that I had a working from home setup. Laptop on my dinner table, and instead of only being able to work from home one day a week, I was doing it constantly. But that was just my experience, right? And alongside that, I was doing things to distract myself, like crafting. Casual socials between friends and family moved on to the internet, right? So it's even attending weddings online. And yeah, who'd have thought that? And also, hands up here, who has to be on the phone with a loved one trying to be technical support for them as they're also trying to join the call? Yeah, we all remember that time. And can we just reflect on what that experience was like, right? Trying to walk them through the various different buttons and tabs and and terms and all of these types of things that we have to do. Helping them download applications and figure out how to use them. Concerts and conferences like this and things like that, which used to require you to travel to specific venues, had screenings online. Some free, some paid for, but the barrier for entry to a lot of things could be reduced because you didn't have those travel and accommodation aspects to consider, right? You could just log on and spend some time online. And so for many people, actually friends of ours who have chronic illnesses or disabilities, there was actually a world of content that was now previously kind of hidden away that was much more easily accessible. Alongside this, at this time, I was visiting the NHS website on my laptop, on my phone, checking time in terms of things related to when I'd be eligible for vaccinations and things like that, what the next information would be. I was able to book in and received a text message. Quite straightforward there. It's really convenient for me. I didn't need to be on a phone with anyone on a queue. I didn't need to wait in queue for that. During work or during lunchtime or things like that, I got to just, with a few taps, book and reschedule. Quite straightforward. I wasn't alone in this. Over the course of that period, 20 million adults booked via those tools online, and 61 million vaccinations across that time. For the vast majority of folks, this was actually the first time using online tools for healthcare reasons. And that's not all. It wasn't just, as you probably know, it wasn't just vaccinations and things like that were moving to digital means. Video consultations had moved also. What is a video consultation? instead of as a patient, going directly to hospital or GP surgery to have a face-to-face consultation with a doctor, nurse, physio. You could use online tools like this one. Here's a mock-up of how this one is actually used. So a patient was booked in for a session and they'd receive a text on their phone with a link taking them to a page where they could use their camera and microphone on their device, whether it's a phone or tablet, to talk to their doctor or nurse. Now, this technology wasn't like brand new. It's been around for a while. But due to the need of not having people like congregating in groups, as you know, the popularity of its usage shot up. And so actually lots of different local authorities had been purchasing licenses and creating contracts in order to have these set up for their citizens. Here's a quote from a patient who had a child who needed to see a specialist at a hospital. She said that she didn't need to take the morning off work, pay for travel, have the inconvenience of waiting around in a waiting room where things are delayed and delayed and delayed, in order to have that 15-minute appointment with the consultant. She could have that in the convenience of her own home when the doctor was available. So there's many benefits of using, being able to use the technologies, these tools. So for many people like me, like this patient here, who benefited hugely from this move to using websites and digital tools to address like a core need of theirs. However, like throughout all of this, as helpful as it is for me and for other folks, I was thinking, who is actually missing out on this? Who isn't able to make use of these tools? So, initially, you have some folks that have patchy internet. So whether it's somewhere rural like this, where you don't have necessarily great signal outside, and actually when you're inside some of the old stone buildings, you don't have good signal inside either. If you ever tried that, or it's some folks in in cities and towns, that because of the way architecture has been built over time, it's actually quite difficult to have connectivity. There are hundreds of thousands of people across the country who use digital services, are using assistive technologies. So this is a photo of a woman using a laptop and also using that in conjunction with a braille display. So to be able to get input and output in a format that works for their visual impairment. There are lots of different types of hardware and software to support folks with various different needs. We could probably spend like a whole conference just going through all of the different types. And if you are interested in that, please come and chat afterwards, because that is a really interesting aspect of technology, for sure. But what we have is that not every website or application or tool is actually set up in a way to help folks that need to use these tools. Whether that is the HTML on the website isn't semantic, and so they have to go through reams and reams of content in the page in order to find out the actual key links and things like that, and key content that they need to go to. There is so much that can be a barrier to folks. Another barrier, no fixed postal address. This is something that to be honest, I hadn't really considered that much in the past. There are actually thousands of people who don't have fixed postal addresses, from folks who are homeless, sleeping on the streets, to those who have a way of life that is nomadic. So people in remote or traveller communities often don't have fixed postal addresses due to the way of them travelling. And so for such reasons, there are often barriers to receiving regular services that are local to them, whether that's healthcare or social care, things like that. A report in 2019 by a community that's like Gypsy Traveller said that 48% of GP practices that they contacted wrongfully refused to register a Romani Traveller person because they didn't understand that they could be registered. And so that might be that their information was out of date, or it could have been that the forms that they needed to fill out required them to have a fixed address with a postal code and a door number and things in a traditional sense. And so the tools and systems and processes were creating barriers that otherwise shouldn't have been there. And did you know, 1 in 5 people in the UK are living in poverty. So if you talk to folks who work in pretty much any industry other than software engineering, that isn't so lucrative in that as that, or listen to the latest news, you'll hear about the cost of living crisis hitting really hard. Bills increasing at a far higher rate than incomes. And many families, not just even the poorest, will need to decide between key essentials such as food, heating costs through winter, and deciding which of their services are like strictly vital and essential, and cutting down things like cutting down internet packages so there's only a limited amount to be used, and that needs to be stretched over the month. And kind of alongside this, in terms of poverty in general, there's a term called digital poverty. And between approximately 13 to 19 million people aged 16 plus in the UK are considered to experience digital poverty. And that's not being able to access and understand the digital realm, and that is being able to interact with things, the full breadth of aspects in the digital landscape that is our digital world around us. So digital exclusion encounters all of these things. It's from not having a device in the first place, or having one but not affording the internet package in order to use it. It's having a tool you need to use for every day, but to access key services. But the barrier is that the website or app doesn't support the interface that you can use. Digital exclusion is also about the processes, systems not being flexible enough to allow to the way that you're currently living your life. And so it could be something like not having a fixed address. It's about not having the infrastructure around you to support you throughout your life. So there are so many aspects around here. So how do we go about even considering and contemplating all of this, right? So many different aspects. So let's break it down to make sense of it in a different way. So in behavioral science, there's this model called the COM-B model, which talks about 3 different categories for understanding some behavior change. So it talks about capabilities, the C, opportunities, O, and motivation, the M, as 3 key factors capable of changing behavior. Let's talk about examples though, because that's a bit more easier to absorb, I think. Capability is a person's ability to participate in an activity. So, for example, are they able to search for an app online on the App Store, download it and install it, and then start using it? Opportunity is about external factors that make that behavior possible. So, do you have access to a device in the first place? Do you have access to internet? Lastly, motivation are the thoughts, consciously or unconsciously, that lead to and inspire your behavior. And so this is like all of the things that have influenced you over time that can have an impact on you. So that's things that you believe yourself and things that other people are telling you. So when we talk about behavior here, it's basically that the behavior that we want to encourage and improve is being able to access essential services such as healthcare or access to social care. Okay. So we have this kind of framework to kind of try and understand the different aspects. But everyone's experience doesn't fit neatly into each kind of part of the model. There are overlaps, and as an individual, depending on even what point of your life you're in, you will encounter different aspects of different types of opportunities or barriers to opportunity. Your capability of being able to do things may change over time, etc. And so this is quite a complex landscape here that we need to understand that this is quite fluid. There isn't a static approach here, that this changes over time. Okay, so that's a lot of things to consider. What can we do? How can we pull apart things related to these barriers that we've talked about and figure how to make change happen? Those of us who are in tech and things like this, and the tech and software engineering and websites and applications, like what can we think about? What tangible differences can we have to make change? Not just at some point in the future, not just as a thought experiment, but to practically make change today, tomorrow, this week. So, first of all, cool. How do we figure out the changes and the choices that we need to make? There are 3 traits that we should consider when thinking about how we build technology and our solutions. So instead of relying on our own assumptions of what people need, to be very research-led. Make sure we're being user-centered. And in this case, user-centered, if you've been around tech for a few years, in lots of product teams, you might hear folks talking about being user-centered, but really what they're focusing is on their website and their content and their brand, and talking about how their product can be like used by most people. This is like flipping that around and being actually like, what does a user actually need from a tool? And then also to make sure that the research and the work that's been done is holistic. So you're not just looking at the 10 minutes that the user is interacting with your website or app or tool there, but that you're thinking about how does it fit into their life, and how can it be used to enhance their whole experience. So let's go through some aspects where we can take some research that's been done carried out by lots of different folks, and talk about what they've learned and how we can apply it. And we'll start off with simplifying, which ironically is the simplest thing to start with. So 15% of adults in England have an English literacy levels age of 9 to 11 years old. So what this means is like, this is a level related to being able to understand complex train timetables or understanding payslips and things like that too. So this is something that I was quite surprised by, but it's actually quite consistent over the years as well, over the last years. So it hasn't really been improving at all in the last few decades. So you can use and address this on tools and applications by looking at plain language. So this can really be helpful for folks with learning disabilities, folks with English as a second language, additional language, lots of different folks. So what does this look like? Here's a simple example of this. So we can change from using a passive voice to active voice. So before, an information helpline is also operated by an ABC hospital trust for the convenience of patients. And after, we also run an information helpline for your convenience. So what this is doing is changing from the passive to active voice. It's removing jargon where it's not really necessary. It's removing any acronyms that are not really helpful for the case. And yeah, assuming no prior knowledge and really centering that person, the reader, in that. Now, when looking at literacy as a whole, that's a whole thing, but then also there's aspects of health literacy, which is your ability to understand and make decisions about your health. And so, so even though you might understand necessarily the words themselves, but in the context of things here, where it's actually 4 in 10 adults struggle with health content and absorbing that and understanding it. Over 6 in 10 struggle with content that includes statistics and understanding what the implications are if you're comparing statistics of choosing between one option for like a healthcare procedure versus another option. And so we can improve everyone's health literacy by taking steps to improve the simplicity of the content that is created and things as well. If you just use the example of health as one, because it's something that impacts absolutely everyone in a certain extent, but it also impacts other aspects where you have, there are other like analogous examples. For example, financial literacy. Do folks understand the impact of taking out credit cards or particular loans and being able to pay that off? Do they understand what the statistics in your statements mean and things like that? So there, for every industry and every aspect, there is an analogous kind of subject here that we could kind of delve into too. But yeah, so coming back to what that simplicity aspect and addressing aspects of literacy. When you design with the most marginalized people at the center, you improve the experience for everybody. So when you consider simplifying your technical explanations, removing that jargon, really explaining the statistics, breaking them down into ways that are easily absorbable, then that impacts everyone in a positive way. And that enables people to make better decisions about their health, their finances, their lives. Here's an example that I love to refer to. The NHS website has a brilliant NHS content star guide. If you haven't had a look, check it out. Even if you've got nothing to do with healthcare or tech at all, it's quite interesting. And so what we have is my absolute favourite anecdote from this is that a while ago they were looking at health content and whether folks really understood like what they're being asked to do. So instead of using terms related to, you know, stool, which is quite like a particular term that people don't really use in everyday life, they wrote and researched that actually across the whole of their literature online, they should use terms that are a bit more familiar to them, so like pee and poo, because that is understandable and you don't need to have any confusion. It's often, if someone's using a translation app for a different language, that's something that is more likely to be translated rather than technical, slightly more technical term, etc. too. So yeah, so that's how you can, so there's lots of creative ways you can use content guidelines to make tech better and simpler. There are also, you can simplify some technical complexity and things like that. So you can reduce the number of interactions that you need to get access to full content. So this is actually a real example on a design that I was working on a while ago. And that is that you don't actually get the, there's a name of a medical practice listed, and there's a button there. And when you interact with that button, there is a tooltip, like the section above that, which shows you more detail about that practice, which in this case is the full name and also the address. Now, why was this approach chosen? You might see it's like, for folks, in this particular case, it was the design considerations. There was lots of things on the page and they wanted to make it quite condensed. And so this is a way to have content still available on the page, but not in the main flow of the page. However, this would assume that you know that you'd need to interact on it, that there's that further information there, that what if you were just searching for the page for address, or trying to find it, or typing out London to try and find where it is, you wouldn't actually be able to know that that content is actually there, but hidden away from you. So by simplifying the approach, discussing with the designers that, hey, this content shouldn't only be available hidden in this way, and simplifying this technical approach, that will make your, the experience much simpler and easier to navigate for folks too. And also, it will actually simplify for folks, you know, who need to use different assistive tools that might not actually know when they're scanning the page, hey, the address is actually here, because there's no information to tell you that it is on the main page. Here's another example. So often we want to do things in really efficient ways when we're building things, right? So if you have like 10 questions, why don't you just put all of the 10 questions on the page, right? Fill it out, boom, submit, done. Actually, that's been shown, studies have shown that that's actually not really so helpful. That actually the helpful way to look at things is to actually simplify that down and just have one single task for someone to do. So in this case, this is an example form from a real live website that's using, which is just asking you for your NHS number to type in. And then once you've typed that in, it will tell you, you know, if that's okay, and then it will take you to the next part of the flow. So this will this enables folks to really focus on one part of the flow to simplify reduce the cognitive overhead and to make it clear what needs to be done next. So another aspect that we can look at is like giving users choice. So that can be, so for example, to not force folks to interact in a certain way. Why is that important? So you might be familiar with this diagram. Equality is giving everyone the same tool and expecting them to be able to use it in the same way. So for example, if you give everybody the same web form to book their appointment and say, that's it, you have to use this, there's no other way for you to book your appointment at all. What if somebody can't use that web form? What if they can't access the internet? What if they can't do that in that particular way in that particular moment, but they needed that appointment? They need to be able to access that. So giving users choices that work for them, that can lead to an equity in experience. And that's what we want to look for, so that you can modify the tool that they're given. I mean, this diagram, you know, boxes, instead of giving them some same box and experiencing them to be able to see the game, you need to give them a different tool so so they can have the same experience, the same outcome. So what can that look like? It can be simpler than you think it even is. We think that online tools are the future, right? I mean, we like to think that, right? That keeps us all in jobs. But sometimes that's not the only way in order to create that equity of experience. So you can be digital first in your approach, your tools, your systems, but that shouldn't necessarily mean digital only. So actually here in lots of NHS trusts around the country, when they're deciding what technology providers to award contracts to provide services to, for example, video calls and other aspects, one key marker, like criteria that they're marked on, is to do with digital inclusion. So do they have a phone line alternative the user is unable to carry out their tasks with their video call? So has digital inclusion actually been considered thoroughly throughout the process on creating these tools? So another aspect that we can consider in our day-to-day is learning about the lived experiences of people. So instead of assuming that the 5 folks around the table that are building the thing have context. So research. I find this absolutely fascinating. I think this is one of my favourite parts of it. I can't understate how useful this can be. Research can be a fantastic way to understand what barriers people are actually facing. I think in any time that I've actually listened into user research conducted by researchers, I've always learned something that we weren't expecting. So that's really, really helpful. Yeah, and what you'll do there is like reach out to folks proactively. Reach out to folks that usually wouldn't be coming to you with filling out the customer complaint form and things like that. So reach out to folks from different underrepresented groups, folks with different access needs and things like that too. And if you don't know how to do that, there are agencies for this. So that's what we've used in the past. There are agencies that kind of go out and scope people, and then they provide a paid service, which can be really, really beneficial. So it's like really, collate that research and bring that to your ideation, your building, your iterating on your services. So it's bringing those learnings into your day-to-day, right? Take that qualitative research data from that interview, or take the actual, if there might be quantitative data, maybe you have like a form that people are interacting with that you want to see how many people complete the whole flow within like that 20 minutes or an hour or 2 hours. And then you can kind of bring that in to your day-to-day processes and like use that to decide how you'd like to improve your systems. So one aspect that I found really interesting, really enjoyable is to learn how to test regularly on devices used by real users. So not on the shiniest new MacBook M4 processor on a high-speed Wi-Fi connection, because that's not how the vast majority of folks are accessing things. There's lots of ways you could do that. There's actually either you can purchase old phones, or there's actually lots of different organizations that can help you get different value ones of these. Fundamentally, in order to address that kind of holistic aspect that we considered before, this is all about building trust. This is interesting because it's about building a relationship between services that are provided, and to not just be throwing something onto a website and being like, okay, that's it. Whatever we've provided, that's the only thing that we are, the only way you can interact with our service, the only way you can access your healthcare, the only way you can contact your local like social services for a key need that you have. So we've talked about the specific changes we can make to the websites and the apps and the processes we go through in order to build them and improve them. But what about things that aren't really in your day-to-day, so you can't really go to your team and address them? What about the systemic barriers to digital inclusion? What can be done about those? So there is the Good Things Foundation has done a lot of research into digital exclusion, and as a result, it's set up 2 fantastic services. There is a national device bank. So this is making devices such as laptops, tablets, phones available to those who need them most by community-based partners. Or if you've got a device but you can't afford a monthly internet connection, they also have the National Data Bank, which is providing free internet data, minutes and text to 500,000 people nationally. And they're working directly with the telecoms operators companies in order to provide that, so that they can have coverage, as much coverage across the country. So in terms of this, right, what can you do? So it can be to raise awareness of this. So in local areas and things, you can donate old devices. If your company is upgrading you, ask where the older devices can be taken to, whether they're companies or your own. There are lots of fantastic things Good Things Foundation are doing. Do check them out. And that organisation and a lot of others are doing fantastic things to influence policy. So that takes volunteers, for sure, to talk about these issues. But there's also aspects, so for example, there's the King's Fund that has a project on digital equity that is working to address like government level policy changes in order to address like strategies in terms of like how do we get national internet access in a way that is much more equitable, that doesn't just prioritize places where businesses are. So there's lots of aspects there. There are different campaign groups and research bodies working in tandem with grassroots organisations. As you may know already, access to shelter, to education are considered universal human rights. Here in this country, we have things like the National Health Service, which is fantastic and so useful for so many of us, and so many of us are proud of it. So healthcare is considered a human right, and everyone deserves access to it, no matter their means of background or the barriers that there are in society. There's another aspect to this, though, which is now that the internet can be so fundamental to accessing things like healthcare and social care, brings the question, is internet access that of a human right, and what should we do about that too? So, we've been discussing breaking barriers to digital inclusion. We've talked about how we can be research-led in our approaches, be user-centered in the way we choose to build things, be holistic in the way we prioritize working on things, approaches to simplify, whether that's the language we use, the technology approaches, giving users choice in order to ensure we have equity in their outcomes so they have equal access. Really learning about people's lived experiences and then ensuring that we can build trust over time. There are different ways to support grassroots organisations in your area, for sure, and influence policy at a high level as well. So, breaking barriers to digital inclusion. Thanks very much. It's all in your hands.
Wonderful. Thank you, Sarah. I'll let you off the stage before I bump into you out there. Thank you so much. What a wonderful way to take us. Whoa! Take us, some of us, those who survive, take us through to the lunch.